name's Di Thornton. I have been working at Pinnaroo Hospital for the last 14 years. It's a acute hospital with 8 acute beds, and it's got 23 aged care beds, and we run a 24-hour accident emergency as well. We deal with anything and everything that comes in the door. It's just the way it is. It's rural, it's remote. We're 230 k's from Adelaide, and our nearest referral centre is 180 kilometres away at Murray Bridge. Farmers have mental health issues and depression and anxiety just like you and I do and other people in the community, so they need access. The last thing a farmer can do at this point in time is take a day off to get in his car and drive to Adelaide, wait for the specialist first up, have the appointment, then drive home when he needs to be fighting the weather. Are we getting a thunderstorm? You know, I need to get this 100 acres off today and get it into the silos. Whereas if all they've got to do is, you know, come 10 minutes up the road or 5 minutes from their house to here and walk straight out of their car, you know, 10 metres into the video conference room, it's sweet.
E-health, in my opinion, and certainly video conferencing, has an enormous capacity to enable small communities to remain viable from a healthcare perspective. A lot of rural remote people are very passionate about what they do in their rural remote communities, but also deserve access and equity to high levels, to high level care, which shouldn't be dependent on the postcode or where they live. So telehealth gives people accessible healthcare services which are convenient. They don't need to leave their town. It becomes economically really important in terms of not only their costs in terms of travel, but delays, hospitalisations are reduced.
Living out on a rural area, I felt that it's been extremely difficult. I've spent days and days early on the phone to basically all the neighbouring towns and the larger towns sort of heading out to clinics just saying, I have a sick partner and I need to get him somewhere, what do I do?
We sort of rang up, you know, looking for specialists, and they said, oh look, you've got a 3 to 6 month wait or a 12-month wait, and we sort of thought, well, that's not really much good. And yeah, that was when Ken originally first thought. He said, well, do you mind doing a teleconference? And yeah, that's when I said, well, look, I'll go anywhere to do whatever. And yeah, we had our first conference and it all went from there, so it was quite good. Yeah, it would have been probably nice, I guess, like Ken's point of view, said it would be nice to meet in person first, but, you know, when you sort of look at a 12-month waiting list and you're at rock bottom, you can't really wait that long. So, you know, we sort of did the conference, and look, I've only gone a lot further ahead since then.
And that's when he was very unwell, and it was just a fantastic experience. I had the 4 little kids to look after, so I couldn't actually go in with him. We came into our local hospital here and used the Telelink, and he just sat there for well over an hour, and he went in broken and came out with hope.
The biggest difficulties that mental health clients face is being taken out of their own environment. One of the things that is very dear to them is staying close to home and around things and people that are familiar. So for mental health clients, I think this has really been a boom and has improved outcomes. With our mental health clients here in Pinnaroo and South Australia, we probably would have done 2 or 3 detentions a year, and a detention is where somebody is involuntarily detained and sent down to a mental health unit in town. Since the advent of the video conferencing technology and the ability for people to keep regular contact with their specialists, we've found, I can't remember, it would have to be 3 or 4 years ago at least since we actually sent somebody out in the old detention. That's got to be good.
You know, to see a specialist and that, you would have to go to hospital, especially when you're in that sort of state, which for young kids, the last thing they want to see is their dad in hospital, and especially for a long period of time. So yeah, to them, I could come here, which is only 20 minutes away from where we live. It's no disruption whatsoever to them because they've got school and whatever else, and yeah, they get to see me at night still. So you can come in for a consult, go home, and it's like, to them, there's no disturbance whatsoever to their lives, and which can be a big thing, really.
The more services we can have in our town keeps people in our town, keeps people in jobs and kids in the schools, and it keeps us alive. You really do look for things staying in your town and services staying in your town, and health is a huge cornerstone of what people look for when they're looking at where they live.
I think most specialists just want to be able to provide high quality evidence-based services to people no matter where they live, and to do that effectively in rural remote communities we've now got telehealth and item numbers to support practice. So I think if specialists can do that, well then you're more likely to keep a critical mass of other healthcare professionals in a small town. So your GPs are going to be much more confident about being well supported by specialists, and a whole range of other allied health and other professionals who also can get access not only to direct involvement of a specialist, but also in their upskilling and training and so forth, are more likely to feel more confident that they can remain in a community. So it sort of has a flow-on effect as well, not only to the people within the community, but the healthcare providers that are providing the local care that then can be supported by the specialist from a distance.
I'm Brian McKenny. I'm the Acting Clinical Director of Rural and Remote Mental Health in Adelaide. We're based at one of the old asylums that we have offices here and serve country South Australians. At the moment we've got about 2,500 completed sessions of telepsychiatry assessments by our psychiatrists, and we have 15 to 20 psychiatrists. So it's a very busy unit, and it's something that's been established for quite a long time. The experience of patients responding to consultations has been overwhelmingly positive. I mean, the numbers of patients, particularly psychiatry patients, who you might think would react quite poorly to this, either by being paranoid or overly anxious or generally uncooperative, is remarkably few. I've been doing this for over 10 years and many hundreds of consultations, and I would say that the numbers of patients who would not continue would be only 1 or 2%.
Hi, my name's Michael, and I have a mental illness, and the type of illness I have is schizoaffective disorder, which effectively means I get depression, anxiety and mild schizophrenia, or I hear voices. All of that means is that I need to see a psychiatrist regularly. And the reason I need to see it regularly is I can relapse and I can recover and I can relapse. And it happens quite quickly sometimes.
I've been seeing Michael for about 5 years as his psychiatrist. He has previously had admissions to hospital, but in recent years we've been able to avoid him coming to hospital through intervening fairly regularly with telehealth consultations, and I think that's very helpful for Michael and his family.
Telemed conferencing is a very useful way of getting in touch with a psychiatrist without having to travel by air or car down to Adelaide. My family can sit in with me and talk and ask questions of the psychiatrist and my mental health nurse. And it means that the whole family can be involved in my recovery, which I think is very, very important.
Michael is very comfortable with telepsychiatry, and we have a fairly relaxed approach where he describes some of his recent problems. We review his medication and talk about strategies for his improvement.
I've found that seeing Dr. McKenny on the telemed, I've been able to build a really good relationship with them at a professional level from their side of things, and from a patient to doctor relationship for me. There's still the confidentiality, there's still the fact that what you say doesn't go outside the room.
The patients, I believe, accept quite readily the benefits of telepsychiatry because travel is particularly onerous for many with family responsibilities and work responsibilities to get to Adelaide to see specialists.
If I have command hallucinations or voices criticising my every thought, those long trips to Adelaide can be a nightmare. Whereas if I have I know that in an hour's time I see my psychiatrist at Telemed, I can talk to him or her and get reassurance and some skills to deal with that particular problem.
Compliance, probably for mental health clients, is an issue if they have to travel, actually getting to their appointments and keeping them. But it's much easier here if they can just come in and do it via the video conference. And mental health clients who are really ill with depression or anxiety struggle with going out. So getting them, all they have to do is just go into a private room that's close to their home and they know that they've got their sanctuary of their home to go back to as soon as this is over. It's much easier to get mental health clients to comply.
I would like to see a lot of psychiatrists and other specialists linked with telemed conferencing to country GPs so they can offer peer support, and also for GPs who are new in the job to be able to access professionals in that particular speciality, because I think that would help them tremendously.
At the end of the day, we don't have resident doctors here in Pinaroo, in South Australia. And if we need to have an emergency consult, it's as easy as dialing up that video. We can do only so much. We're nurses. And at the end of the day, it's the knowledge and skills of the specialists and the GPs that we need to tell us. Sometimes we know a lot of things, but we don't know everything. We don't have the same breadth of experience. So it will save somebody's life. It has the ability to do that, and it has done it for us in the past.
Seeing someone face to face is good, but you don't really notice much difference in a way. I mean, Ken's, you're on a big screen in telly and you can hear everything, and I had no challenges or no regrets, and I'd recommend it to anyone to go do it, especially in rural areas.
I think most specialists have got a very open mind about it. So if you've got someone driving a long way to see you, I think if we actually put ourselves in the person's point of view, what is in their best interest in terms of their healthcare.
So from the word go, it was a very positive experience for us. It was sort of what we needed in the nick of time. Video conferencing is certainly the easiest solution, the quickest, and sometimes that's what you need. So I would almost promote that above. I'd just say get out there and use it, because it's a fantastic resource that is totally underutilised.
Telehealth is an absolute godsend, and we just need to use it more and more and more. It gives us access, and it saves the community the travelling that they need to do. It's a safe way of doing things.
I just think that from every point of view, the telemed is certainly the way to go.
Yeah, can't really speak highly enough of it.